So we're going to take this opportunity to talk about a few case studies. First, we're going to talk about the depletion dominant face. We talked about this earlier, where you see the full cheeks, the narrower lower face, the triangle of youth, and you look at an older picture where the deflation mimics descent. Lost the cheeks, deflation, you see a square and the upside down triangle. So all these words over here are exactly what I've done with my plan to restore his facial shape. But in a nutshell, what I've done is I'm adding something back to his cheeks. In this case, it's surgical, so I'm using his own fat. I'm restoring the deep compartments. I'm restoring the fat lost beneath each heavy wrinkle. I'm also releasing these wrinkles with what's called subcision, and I'm going to be adding into the dermis something called nanofat, which essentially are replacing some of the stem cell effect that's been lost over time. And then we're going to do a lift operation that restores the shape of his face. And in this circumstance, we're doing something called a high lamellar deep plane facelift, because I don't want to lose any volume to his face. And then finally, we're going to treat the surface area with a CO2 laser that creates a resurfacing and ablation of all those wrinkles. So if we look at his results, 18 years of age versus 56 years of age preoperatively, and then see him at 1 year postoperatively, we can see we've restored the cheeks, we've restored the shape to his face, and you can see the overall quality to the skin. The surface area has been improved. So we've done all three things. Architectural improvement with improvement of the shape. We put the masses, the spaces between them back together, and we've given him a new surface to make him look rejuvenated. Now, he certainly doesn't look 18, but when you look at 18 years of age and 57 years of age, 1 year postoperatively, it's obvious he's not a different person.